Front page review of the nursing care plan. Stay with me. If you have your own care plan, pick it and let's fill the front page in real time. So this is a customized nursing care plan. Don't get it twisted. AbiggaboyRN nursing care plan. Now, the first thing you notice is that there's a candidate index number here. This candidate index number is the index number of you, the one writing the care plan, or you, the student. So we put it, let's say you have your index number is 62236234001. That's your index number. So you type it there or write it there. Then you come to the signature. The signature here refers to you, the one who just put your index number here. That's you, the person writing the care plan. You sign it to authenticate it. That's what you are doing. Then you see personal data. It has nothing to do with you. It has everything to do with the patient. That's the patient biodata. We are only supposed to fill it. So check this. Most of this information are found in the patient folder. So name of the patient, you type it here. So let's say our patient is called Mr. Adongo. Mr. Adongo. Should we be giving Maxwell? So that's our patient's name. Okay. So having written the patient name, the next thing you have to do is to indicate the ward in which the patient is admitted. So our patient is admitted into the male ward. So here, type, if it's the male ward, just type only the male. Don't say male, don't type male ward. And so that's it. So you see bed number. Bed number, you indicate the bed on which the patient is admitted. So if your patient is admitted on bed 12, just write there bed what? Bed number what? 12. And that's it. Then you see inpatient number. It's also found either on the attendance card or on the patient folder. You type it here. So in our case, our inpatient number for this patient is BMC/002/2026. So that's our patient inpatient number. Then age. Age here also refers to the age of the patient. How old is your patient? You put it there. So how old is Mr. Adongo? Maybe Adongo is 27 years old. So just type here 27. That's it. 27. 27. Then sex. By sex, you are referring to whether Mr. Adongo is a male or female. So you type it there or you write it there. It's a male, right? Male. Adongo is a male. Then religion. Religion is asking you, is Mr. Adongo your patient a Christian, a Muslim, Confucianist, or Buddhist or traditional religionist? Which one it is? So Adongo clearly is a Christian. So we write the Christian or we type the Christian there. Christianity. That's it. All right. Then occupation. Occupation has to do with the work the patient is doing. What is your patient occupation? If Mr. Adongo is a teacher, you just have to type in their teacher, and that's it for you. Then you come to diagnosis. Diagnosis here is the medical diagnosis. Okay, what condition is the patient admitted with? You type it there. So in our case, our patient is diagnosed with malaria, right? Malaria. We type it there. It's a medical diagnosis. Then you realize that the next thing you see is the surgeon. That has to do with who admitted the patient. Who admitted the patient? The physician, the doctor, we are looking at the doctor or the surgeon that admits Mr. Adongo. But in our case here, we will choose it's not a surgeon, that's the physician himself. So let's say the physician is Dr. Dr. Amwaku Hini. Doctor. Oh, Dr. Amwaku Hini. Aha, that's our doctor. So operation, what information do you need here? This is a patient diagnosed with malaria. So operation here is not applicable. So just indicate not applicable. Just indicate not applicable. Not applicable. Yes. Then the next thing is date of admission. Here we expect you to put date on which the patient is admitted. So our patient is admitted on the 10th of April 2026. That's date of admission. One more information is about date of discharge. Here, the patient is still in the ward. Patient is in the ward, and you are writing the care plan. Okay, so it cannot be what? Discharged. And so, if not discharged, you have to indicate that not yet. Patient is not yet what? Discharged. So let's go. So just type there, not yet. That does it for the bio data. Then what actually make the care plan difficult for a lot of nurses is this one. Patients' health problems. Here you have to state at least 4 of the health issues that the patient is what? Reporting. Okay. So this patient is suffering from malaria. So let's say patient has fever. You have to state it quite clearly. Don't mince words. State it quite clearly. Patient. Let's say our patient has fever. Okay, our patient has fever. We are doing it in real time. So make sure you put the fever into brackets. Okay. So 39.4 per the scenario we are using. So I say always make sure you state at least 4 of those problems. So patient also complain of headache or body pain. So let's say patient complained of headache, or let's say generalized body pain. Pain. All right. So we say we are writing 4. Which should be the third one? Okay. So this patient also is reporting feeling weak. Because when you have malaria, you have this generalized body weakness. So patients have complained of generalized body pain, and then this patient also, let's go, patient complaint of feeling what? Weak. Let's put it like that. Complaints of feeling. He was feeling weak, right? Weak. So that's one of the patient complaints. I say let's always make it 4. So if you are stating 4, let's add one more to it. What else do you think that patient complain of? This patient complain of vomiting as well. This patient complain of vomiting. So let's put vomiting there for this patient. Patient complain of vomiting. Or together, let's think of it. A patient who is patient complain Patient complained of vomiting. Complaints of severe vomiting, because the scenario said that patient has been vomiting for the past 3 days severely. So that would do for our 4 problems. Okay, so having stated the problem, you now come to the you now come and state what we call allergies. Allergies. See, when the patient is allergic to anything, you have to state it here. Patient could be allergic to drug, some chemicals, dust, and what have you. But when you find in the patient folder and you speak to the patient could not tell you anything. Simply put here, or you can state that patient has no known what? Allergy. So let's go type it there, that patient has no known allergies. All right. So that's it. So you leave it at that and you proceed. You don't have time. You don't have time here. So patient strength. Now you must know, this is why it gets critical. When you are stating the patient strength, the strength of the patient has to correspond with the patient problem. Don't forget that. Always make sure that when you state the patient problem, you have to state a corresponding for strength. So let's see. Patient problem number 1 is that patient has fever. And then the first strength has to, a strength is that which, that ability, that little ability that the patient has left in him, that strength, that resources, that behavior of a patient that will assist in taking care or solving the problem is what we refer to as what? A strength of a patient. So here we could say that once, the underlying cause of this fever is the plasmodium what? Infection, so that infectious process ongoing is the reason why you have this high fever. So if the patient can tolerate or is willing to take prescribed medication or antibiotics, then that has become a strength of for the patient. So let's go. So our strength 1 is to state that patients why is it bolding? It to state that good. Is to state that patients is willing to tolerate what? Prescribed medications. Okay, so I leave a medication because it could be antipyretics, it could be plasmodic. So that's it. So look at problem number 2. Problem 2 say patient complain of body pain. So what should be the strength? If the patient is even able to verbalize the pain, that's a strength. If the patient could also locate the pain and then tell you the severity or the intensity of the pain, that could also be a strength. So we could say that patient, so let's say that patient could report location and maybe intensity of pain. That's it. So that has become a strength. So now look at problem number 3, that complaint of severe vomiting. So the patient has been vomiting. What do you think the strength for that vomiting will be? If the patient can tolerate oral fluid or even sip a bit, in spite of the vomiting, that could have been what? A strength. So patient could tolerate oral fluid, right? Let's use that, oral fluid. So that's a strength. Problem 4, a patient complained of feeling weak. So a patient who complained of weakness, he cannot get out of bed, he can't do a lot of basic activity, he cannot perform them. So what do you think the strength will be? What do you think? If the patient could do a little, perform a little activity with a minimal assistance, that could be it. If the patient can move independently with a minimal or little assistance, that's it. So we can say that patient uh, patient patient could patient could move. Let's use move. Let's say independently. Patient could move independently with a little, with a little. Is it little or minimum? Let me use minimum, or minimum assistance. So that does it for strengths, and so that's it. That does it for strength that are corresponding with the problem. So now we come to routine care. Routine care, routine care, routine care. So these are routine care. Take note. Routine care. These are what? Routine care that ordinarily you perform all the time in the world. So routinely for this patient, let's see, TPR. Our vital signs chart is called 4-hourly chart. So here you just say the number of time it is done. You don't have to state anything else. So it's done 4-hourly of, yes, let's say 4-hourly. 4-hourly, right? 4-hourly. Forgive my, I'm not very good at typing like that. Just managing to give it to you, so forgive me. So BP, I think same. BP2, unless in specific situation or specific condition, it is still 4-hourly. Okay, so depend on the condition, but routinely we check temperature every 4-hourly, every 4 hours, and it goes with the BP. But I'm saying that in certain circumstances specific to condition, it can be 2-hourly, once daily, or even more. All right, now let's come to diet. So routinely, normally we take nutritious diets, right? We can take nutritious so there could be nutritious diet. Okay, here I need to explain further. Okay, normally in ideal situation, everybody wants to take a balanced diet, nutritious diet, and what have you. But in some specific situation, you can also be taking restrictive what diet. Sometimes the patient is on meal per hours. You must indicate that if the patient is on meal per hours. Sometimes too is NG2 feeding. You must indicate that. If it's that restrictive, there could be low sodium diet, there could be sugar-free, high protein. Sometimes have total parenteral nutrition where you have celimid and celipid pass through the veins. Okay, you can only so when it comes to diet, um, I'm sure when it's problems or condition specific, you will know what to state. I've just given you some clue as to how to go about them. Then we come to IV fluid. IV fluid. So under the IV fluid, so you can have nutritious diet, nutritious diet here. I don't want to state more to confuse you, but it is. Fluid, you could have Libra, you know. Libra, okay. It could be Libra. There could be IV fluid, just like the diet again. The person can also be on nil hole per us. Okay. So Libra, we'll leave the Libra there. It could be IV. You could also state IV fluids, right? It could be IV. So let me put maybe hot IV. IV. IV could also do for you, depending. Then look at intake and output. For intake and output, we always measure it every 24 hours, right? So just say that it's 24 hourly. And take note that in some cases, it is not requested. You only institute intake and output chart if it is requested. So if it's requested, know that it's 24 hourly that you close it. But where it is not requested, just indicate not what requested. So for the sake of our patient, we'll do 24 hourly because it is what requested, 24 hourly. Oh. All right. So it means that every 24 hours you monitor and you balance it. So that's about that. Okay. Oral hygiene, mouth care, mouth care. We take care of our mouth in the morning, we take care of our mouth in the evening as well. So that could also be twice daily, right? That could be twice daily. So let's do twice daily. Twice daily. Uh bath. Bath. I think the same applies. The same applies unless, of course, as if it's condition specific and something else is requested. That's what you do. Urine testing, you know, routinely, so many of the facilities we have in Ghana don't request for urine. Urine testing is condition specific, unless of course you're having some STIs, and then we can be talking about urine testing. But most often it can be done on admission. If it is requested on admission, then you could just indicate that it's requested on admission. But in our case here, it is just not what applicable. So indicate that urine testing is not requested. But if it is done, you can also indicate that it's done. If it's requested, indicate it's requested. If it's on admission, indicate that. But in our typical situation here, we can say that here it is not even what applicable or not requested. So let's put there not what requested. So not requested. All right, so that's about that. Then we look at body weight. Body weight, most often than this routine stuff has to do with nutrition stuffs, right? Body weight. Sometimes you know that routinely there's no patient that pass through the OPD and as part of the vital signs and the weight is not checked. So most often than not, it is done on admission. But condition specific can be done once daily. It can also be done twice daily. But in this our case, it was on what? Admission. So done on admission. Okay. So you can indicate that that on admission and leave it like that. So activity here, it could be active, passive, you know. So these are our patients. This our patient, that's our problem. Let's go back and look at the problem. We say that the patient is feeling weak. So this patient is passive, right? So just write there passive. Passive. So it could be passive, it could be active. Active could be ambulatory, and it could also be what? Passive inactive. That's it. Well, it takes some time because I've been explaining, but I hope it's worth the time. It will take you some time to go. This is just the front page. I encourage you to subscribe to the channel whilst you wait for part 2, which covers the inside page and maybe the outside page. Note that the front page, as you see it, as we've done, takes how many marks? It costs you 6 marks. When you are able to provide all this information, you score 6 marks. So take note of it. Thank you and bye-bye.